I know that some people are looking to do phantoms for calibration of equipment, that kind of thing is being explored. Not necessarily radiology again, but like radiation therapy. There are groups that are doing radiation therapy with 3D printing, so patient-specific bolus models to direct the therapy is another thing that I have seen groups using. But right now, radiology, I mean, they're a core constituent, they're a key stakeholder, and in a lot of cases, they are a driver of the programs. And so, I mean, if you look at the Mayo Clinic, it's really a radiology-driven program that they've set up because they're so central to the process of getting the patient-specific data and interacting with the clinicians to make sure the model is right. So, so that's really the role that we've typically seen radiology playing, either as a stakeholder or as actually the driver and owner of the program.
Well, the other things that I've seen in radiology, it is mostly research-based. We are looking, for example, into using 3D printing as a model to diagnose disease severity for vessels, a way to diagnose the severity of a disease. Just take a vascular model with a problem and then 3D print it and then look and see flow patterns, pressure drops, and so far. We can do some ultrasound Doppler on these models and see how the pressure relates to the velocity. But as I said, this is more of a research. I'm aware of other people that are trying to use 3D printing for MRI applications to optimize their sequencing. But then you have a problem to match the 3D material with the with water equivalents and so, or bones. And finally, the other one would be characterization of the models. For example, in CT, the CT and MRI, but especially CT, it is known for ability to see low contrast objects. And people are trying to develop what is referred as CAD models, which is not the usual computer-aided diagnostic. It stands for computer-aided diagnostic or aided diagnostic. So these are programs that can go and search various pathologies and then come up with with culprits for lesions, like for example in breast cancer. Says this can be a lesion, this cannot be a lesion, and so far. So those programs use templates to learn. It's a learning process. So the computers are learning various pathologies, and if you want to present various combinations and make your computer learn about these diseases, you can 3D print various configuration, various situations, and let your computer look at it. So you can kind of simulate, let's say, low contrast lesions into an object and see how well your program does in detecting those, or you can put it to learn and to use it in humans as a diagnostic tool.